Okay. Good afternoon, everybody, and I'm delighted to be here speaking today, and I'd like to thank the Irish Cancer Society for inviting me and to also acknowledge the fantastic work that they do. My name is Patricia O'Regan, and I presently work as a lecturer in nursing studies in UCC, University College Cork, and my background is oncology. I worked as an oncology nurse in clinical practice for many years before I went into education. And I suppose I have a passion for oncology nursing. And today I'm going to speak about two very important topics, cancer-related fatigue and cognitive impairment as well. And I'm first going to talk about cancer-related fatigue. Oh yes, the slide has moved across. So what is cancer-related fatigue? Cancer-related fatigue is defined as a distressing, persistent, subjective sense of physical, emotional and/or cognitive tiredness or exhaustion related to cancer or to cancer treatment that is not proportional to recent activity and interferes with usual functioning. Now, there is a lot there, but basically cancer-related fatigue is really encompassing of the whole person. It's not just physical. It's not just that physical tiredness. It's also very much cognitive. It's the whole person, their emotions, and their really their ability to carry out normal day activities despite the fact they might be after having a really good night's sleep. It's the most frequently experienced symptom of cancer and cancer treatment, and it's also considered the most severe and the most undertreated symptom. And that has been the case, unfortunately, for many years as well. What is the cause? Now, I'm sure I'm probably talking to a lot of people here today who have experienced fatigue, maybe are still having ongoing fatigue. And for many of you, you probably had one or two forms of cancer treatment. And unfortunately, they all do cause significant levels, really, of fatigue, some more so than others. And literally every cancer treatment, as I said, is going to cause fatigue. So, and it is therefore almost universal in those receiving treatments. Now, the exact mechanism that causes fatigue is unknown, but there are a number of ideas, and hypotheses, and it is found that prolonged stress that cancer patients endure produces a stress response. Also, there is increased energy needs in the body, and there is physiological factors as well. So people might become anemic. They may be having other treatments and become cachexic or underweight as well. There might be nutritional issues. People may have a poor diet and not having adequate energy as well. There may be psychological factors, and there may be other drugs involved as well. And there's a lot of common everyday drugs that we take, many over the counter, that can have a sedative effect as well. And these can include things like anti-nausea drugs, painkillers, and especially stronger painkillers most certainly do have a sedative effect. Also things like antidepressants, antihistamines, cough suppressants even, and antacids. Some of the cough suppressants will contain a certain amount of codeine. So looking at cancer-related fatigue, specifically in survivorship, cancer-related fatigue is found to be the most common and distressing symptom identified by many cancer survivors in numerous studies. Approximately 30% of patients continue to experience severe fatigue 1 year after treatment, and 20% of patients still report severe fatigue at 10 years post-treatment. And again, I think the research shows that those that have, intense treatment, so especially those who've maybe had bone marrow stem cell transplant and high-dose chemotherapy, have ongoing fatigue, in some cases up to 20 years post-treatment, some studies have found. As you can imagine, higher levels of fatigue go together with a worse quality of life, lower functioning, and lower ability to work as well. Studies that looked at breast cancer survivors, a number of studies have been done, and they found that up to 1 in 4 people considered that they still had severe fatigue ongoing as well. So fatigue and survivorship is reported as being infrequently addressed by healthcare practitioners, and its impact on quality of life is underestimated. Cancer-related fatigue is different from other types of fatigue. People that get fatigue if they're have been working really, really hard on that, and generally it improves with rest. But cancer-related fatigue is very, very different. It is very persistent in nature, and I just gave you some statistics there. And the inability to alleviate through rest and sleep, they're, I suppose, the key characteristics of it. It's multifactorial. There's many causes. It's subjective. It's really subjective. People might have the same diagnosis, the same stage. They might be 6 months post their treatment, a year, and no 2 people will be the same. And it's rarely isolated. Generally, people that are talking about having fatigue, it often occurs in what we call symptom clusters. And it's found in symptom clusters of pain, distress, anemia, and sleep severity. And of course, it's understandable if you're not sleeping properly, and not you're waking up not refreshed after a night's sleep, of course you're going to feel fatigue as well. So I often say one symptom has a knock-on effect. And I think also as well, each physical symptom has a psychological component that's important to remember. There is a strong correlation as well between fatigue and psychological symptoms, depression and anxiety. And sometimes, people are misdiagnosed as having depression, for example, when they may have fatigue, and vice versa, because the symptoms tend to be very similar. So I suppose if you're thinking, if you're at home and thinking, God, you're feeling, quite exhausted all the time and all of that, do get yourself, go to your GP and do get checked out, or if you're still linked in with the cancer services. Fatigue limits the quality of life of survivors and their reincorporation to normal life, including their ability to return to work. And a number of studies, I suppose, in recent years have been looking at survivorship and issues around employment. And it has been found that, some people may retire early, some people may go from full-time to, part-time work and that. And often it is related to fatigue and the next symptom as well that I'm going to talk about, cognitive impairment. So, for survivorship, what I would say, though, is that fatigue that initially presents months after the completion of treatment and that worsens over the period of time warrants, further evaluation. So do go back to your, whoever your team were, and if you're a good bit of time post-survivorship, especially as well. So how is it managed? Well, it is difficult. It is a difficult symptom to manage. Unfortunately, it isn't like many of the other physical symptoms. If somebody's got pain, there's a lot of good analgesia on the market today. If somebody has nausea and vomiting, if somebody's got constipation, there is generally, good medication that people can have. But it is not, unfortunately, there isn't a magic pill for fatigue. But pharmacologically, is there something else going on for the person, all right? So if somebody has pain, okay, certainly being pain-free is going to help your sleep, as I mentioned, which is going to have a knock-on effect with your fatigue. If people are emotionally distressed, all right, if they're feeling very anxious, all right, if they can have help for that. Maybe somebody is depressed and maybe they do need to go and get pharmacological help for a short period of time. Or check out as well if people are anemic, all right? If you're feeling, really, really drained, do go and get your bloods checked, because again, most certainly if you are anemic, it is going to impact on your fatigue levels. So what I say is reverse the reversible if possible. In relation to non-pharmacological, which I suppose is a big area that I suppose research has been focusing on, and trying to, I suppose, explore what can be done. And over the last number of years, exercise, all right, and I know you're going to get a very good talk on exercise this afternoon, but in relation to fatigue, the most supporting evidence to date shows the effectiveness of exercise. So really, really, it is so beneficial to do that. And prolonged periods of being sedentary and not engaging in physical activity can lead to loss of skeletal muscle mass and strength. So perhaps people, were having whatever treatment, radiotherapy, chemotherapy for a period of time. They weren't doing their normal activity, and this prolonged period of being sedentary is going to impact on them further. So regular exercise, we know, builds up your physical fitness level, also improves your energy, all right, thus your fatigue levels, strength, balance, stamina, and coordination. And the current guidelines, as we heard earlier, are recommended to approximately 30 by 5 sessions a week. 150 minutes minimum is recommended. And this can be any form of aerobic exercise, so fast walking, cycling, swimming, or I suppose really to work within your limits. And evidence is now showing as well, all right, where people are able, obviously, to the benefits of strength training for fatigue as well. But again, I'm sure you'll hear a lot more about that this afternoon as well. In relation, I did mention there anemia earlier on, and I suppose again, if at all, like our very good speaker there on nutrition, to try and get everything from your diet wherever possible, and altering your diet to include more iron-rich foods, especially your green leafy vegetables, all right, can be very beneficial. And there is ongoing research as well about the benefits of vitamin D and ginseng, but it's ongoing research and it's not definitive as yet. So what can you do yourself, all right? I suppose just some common tips and strategies. So certainly treat, if really, I suppose, when talking with your GP or your oncology team, if you're still linked with them. So is there something, physically that can be helped? Do you have poor sleep? Do you think you may be anemic, pain, distress, as I mentioned earlier on? Rest and sleep for I suppose what is recommended is for 7 to 8 hours a night. And I suppose we're all very aware of things that we should do to help us sleep, avoiding technology for up to a couple of hours beforehand, not having our mobile phones attached to us, in the bedroom, etc. And trying to avoid caffeine, for a number of hours before we sleep. Take a nap if necessary, and especially, I suppose, during and soon after treatments, you will be exhausted, and it is important to rest the body. But if you do actually go to sleep during the day, it's recommended not to sleep for more than 20 minutes, because more than that, it's going to upset your circadian rhythm, and you're not going to sleep properly then that night. Having a balanced diet, as we know, fresh fruit and vegetable and protein as well is important. And I think the recommendations are approximately 20% of the diet should be protein, and have that protein spread out during the day as well. Pace yourself and plan your day. So spread your tasks out over the day and sometimes the week, and prioritise ones which need doing the most. Do a little bit each day rather than a lot in one go. Try and reduce your workload, all right? So maybe things like doing online grocery shopping rather than having to trek to the shops twice a week. Is it possible to get a home help in or a cleaner? Batch cooking rather than cooking every day. Can you batch cook twice or 3 times a week and freeze it? And sometimes having pre-prepared foods as well, and buying, your vegetables and sometimes pre-prepared meals as well. Also, in relation to there I mentioned about home help cleaner, contact your medical social worker. You may be entitled to getting home help that you're unaware of. And even things, when you are cooking, try and sit down so to avoid bending and stretching and that when you're preparing meals. So just some tips to help fatigue there. So keeping active, getting adequate rest. Sorry, I can't read my writing. Save your energy, prioritising, asking for help, eating a healthy diet, getting your exercise and getting support from others as well, especially if you are very distressed and anxious from the symptom. And as I said, look into, I mentioned earlier on, if you are anxious and distressed, there's lots of cancer support services, and it's supposed to eliminate that you don't have depression as well. I'm next going to talk about cognitive impairment, but there is actually, I suppose, a big link between the two. And people frequently describe cancer fatigue as including brain or cognitive tiredness or exhaustion that is, again, not proportionate to rest. So people describe things like, it's like my brain is so tired, I'm too tired to talk. My brain is just too tired to think. And cancer-related fatigue has been found to correlate with a cognitive impairment. That should read cognitive impairment as opposed to fatigue. And so fatigue correlates with cognitive impairment in people with a cancer diagnosis. Fatigue negatively impacts on the brain's executive function, on memory, on word recognition and processing as well. And increased levels of fatigue regularly have been identified with worse cognitive defects. So in studies that showed higher levels of fatigue, constantly patients and people described having cognitive impairments. And also a number of studies have identified that fatigue severity and its impact were significantly associated with lower brain processing speed and complex attention. Both patients and survivors often experience change in cognition, which is also called, especially in more recent times, cancer-related cognitive impairment, and as a side effect of cancer and cancer treatment. And this is a term to describe the decline in people's cognitive functioning. Cognitive impairment occurs in up to 30% of people prior to any treatment whatsoever, and in up to 75% of people during their treatment. Then post-treatment, numerous studies have shown as high as 75%, some as low as 12%. So I suppose, again, it very much varies according to the group of patients in these studies. But as high as 75% of survivors have been found to experience cognitive impairment, and in some cases up to 20 years following completion of treatment. As you can imagine, the development of cognitive impairment affects quality of life and can result in diminished functional independence as well. Cognitive impairment includes symptoms such as having a poor memory loss, drowsiness, inattention, particularly in complex information processing speed, working memory. So maybe reading, a long paragraph or reading a book in many cases, learning efficiency as well, and executive functioning as well. And the potentially negative consequences of cognitive impairment are emerging as a key focus of cancer care research. So it's really, I suppose, in the last number of years that it has been recognised as such a significant symptom as well. What are the causes? Again, like fatigue, cognitive changes in people with a cancer diagnosis may be induced by the treatment or by the presence of cancer. Chemotherapy, people often describe having chemo brain or chemo fog, and this occurs in up to 70% of people receiving chemotherapy. Now you can see there are some as low as 13%, but it very much depends on the type of chemotherapy agents that are used as well. So the higher incidences, some type of chemotherapy agents are linked to higher levels of cognitive impairment. Patients receiving brain radiation as well often experience radiation-induced fatigue and headaches, and in addition to cognitive impairment. Other possible risk factors include obviously administered treatment, but people may also have a genetic predisposition. Older age is linked as well to higher levels and, I suppose, faster decline of cognitive impairment. And again, psychological factors. It has been found that people that are more anxious, that tend to be suffering from depression or fatigue, again, as I mentioned earlier on, are going to have higher incidences of cognitive impairment. Multiple studies also suggest that hormonal therapy for both men with prostate cancer and women with breast cancer can have an impact on cognition. And that is because when people go on hormonal therapy, the estrogen and progesterone depletion can cause cognitive impairment. Then, I suppose, other factors, medical conditions that may also affect the brain, which are those that can affect the vascular system. So, for example, people that have diabetes or hypertension, high blood pressure as well, may have a role. Poor nutrition and dehydration. Okay, if people are quite dehydrated, this can lead to electrolyte imbalance that again is going to impact on them. And again, low, like what I was talking about with fatigue, if people are anemic, all right, and they have their hemoglobin, they have low levels of hemoglobin, this will result in hypoxia and decreased oxygen delivery to the brain. Just some common symptoms that people often describe. So things like being disorganized, difficulty with concentrating, finding the right word. This is very, very common, all right? I think especially post-treatment, all right? People say, God, I just can't think. It's on my mind, but I don't know what to say. I can't think of it. Multitasking, learning a new skill, feeling mental fogginess, all right, and they mentioned that earlier on. Short attention span, so again, the inability maybe to read something long or even have a long conversation with a person as well. Short-term memory problems, taking longer than usual to complete routine tasks, verbal memory problems such as remembering a conversation, trouble with visual memory such as recalling an image or a list of words, and feeling mentally slower than usual. Confusing dates and appointment, not being able to remember maybe somebody's birthday or, certain anniversaries or that. Misplacing objects and fumbling for the right word or the right phrase. And survivors experience cognitive impairment typically report feeling less sharp post-treatment, and in some cases, for many years post-treatment, and especially with greater mental effort required for everyday tasks. Cancer survivors report that cognitive impairment contributes to diminished quality of life, all right, so economic, all right. I spoke earlier on about employment issues, all right, so if people have to, because of their cognitive impairment, are no longer able to work or have to change their work or reduce their work hours, etc., that is going to have a knock-on economic effect. Emotionally, of course, it's going to affect people, and there's going to be interpersonal costs as well. And studies have also found that survivors report greater occupational difficulties. During the 5 years following treatment, studies have found that people were able, though, to recover much of their cognitive functioning. So, especially, as I said, I suppose, as time goes by following your treatment. But verbal recall, which is the ability to call up a known word, one that is on the tip of your tongue, like I mentioned earlier on, however, was more difficult to recover than other functions. Some functions, such as verbal fluency and executive functioning, that includes abilities such as planning and organising your work, perhaps, improved during the 5 years post-treatment, whereas motor skills did not. So this slide there just shows, which I've really talked about, the factors known to influence cognitive impairment, your treatments, and your, of course, a person's psychological well-being, their mood as well. So how do we manage this difficult symptom? I suppose, again, like fatigue, there isn't a magic pill that we can have. But there is, I suppose, in recent times, especially ongoing research that is showing us that regardless of the cause, cognitive rehabilitation, CBT, cognitive behavioural therapy, and mindfulness-based interventions have the most evidence of effectiveness to date. And recently it has been proposed that the combination of cognitive stimulation and physical activity could be more beneficial for survivorship. So, basic lifestyle things that we can do, and again, a lot of these are similar for fatigue as well. Exercise, again, the literature is showing us the importance of this. Increased oxygen circulation in the brain will occur through exercise and improves brain functioning. Nutrition-wise, some recent studies have shown how increasing vegetable intake, and these studies were done in elderly people, actually, but these were found that they improve brain functioning. Self-care, self-managing, staying mentally active, reading, active listening, taking notes, brain games such as Sudoku, crosswords, quizzes, etc., routine and forming good habits. In relation to medication, there is minimal, I suppose, medication, and obviously it would be used, with caution. But certainly things like I mentioned earlier on, cognitive behavioural therapy and cognitive rehabilitation, in the studies that have been done have been shown to be very effective. Computer-based strategies, there's a number of web-based programs that people can use. Complementary therapies, things like art therapy, meditation, music, relaxation, are all very beneficial as well. And of course, again, key, like fatigue, is trying to reduce stress as much as possible as well. Cognitive training. Now, this is a behavioural method of training based on models of neuroplasticity, where cognitive skills can be improved using drills to exercise the brain. So, repetitive exercise to train your brain, memory and thinking exercises may help your brain repair broken circuits that may contribute to cognitive impairment. It's important as well to track and understand what influences your memory problems. You might find it, more difficult to concentrate, when you're tired, when you're hungry at a certain type of the day. People often get that slump in the afternoon or evening, or some people are, they often state that, their brain functions better at night, and for some people in the morning. As I said, exercise your brain. If possible, all right, and obviously, you don't want to be very fatigued. You want to have a certain amount of energy as well to be able to take up new hobbies. But if you have, I suppose the time and the energy, take up a new hobby or skill, all right, to, something new that you're learning. And again, the research shows that taking up a new language and learning a musical instrument actually is really beneficial for helping the brain to, improve its cognitive, decrease cognitive impairment as well. I suppose other practical coping strategies would be things like journaling, all right? Keeping a journal can be really beneficial. Sometimes, that might be things like reminders for yourself, key things to do, but also journaling, your thoughts and your emotions, writing down when you've had a good day, a bad day, etc. Keeping a list of reminders and post-its at hand. Staying organising using calendars or planners, and that might be, in a paper exercise, or you might have something on your phone as well. Focus on one task at a time, not avoiding multitasking. And keeping things as simple as possible. Try and avoid becoming too tired. As I mentioned, take a nap, but not more than 20 minutes. Complementary therapies like meditation, yoga and Tai Chi. And control what you can about your working environment, all right? So, keep it as simplistic as possible. Take frequent breaks, but divide your tasks into portions. Make a list of what is the priorities for the day, all right? And again, rather than trying to do it all together, break the chunk into smaller bits. And get into a rut, all right? And what I mean by that is so things like your keys, your glasses, your household, things that you use all the time, put them into the same place so that you have to think, where did I put that? Because some people, they drive to the shopping centre, they come out, they don't know where they've parked the car, they can't remember, things like that. Where did I put my keys last night? So, finally, the take-home message, what I would say is that fatigue, all right, and it's important to know that it is more severe than fatigue that healthy people experience. It can fluctuate during the day and can have more than one cause. So do try and find out, be it talking through your health care provider, is there another reason why you might be feeling so tired? But it is normal to feel fatigue after your treatment, and in some cases for quite a while afterwards. But generally, it does improve over time. Both fatigue and cognitive problems can occur long after treatment finishes, which can make return to normal lifestyle and work difficult for many people. So, is there ways you can adapt things? Maybe you do, need to change things, whether it's your employment or there's certain things that maybe you need to, maybe you're trying to do too many hobbies or that you need to actually decide what is the most important. There is no current standard of care treatment for cancer-related cognitive impairment, but there is growing evidence that cognitive rehabilitation programs and exercise, and when they're combined together, do work. And several types of interventions have proven to be beneficial in reducing fatigue and cognitive impairment. And as I said, especially, you yourself, by doing more exercise when you can, is going to be beneficial. So there's just some useful resources there that, again, I'm sure the slides will be available to you. So there's things there with chemo brain, coping with fatigue, and guidelines for survivorship as well. There's lots of references there if you wanted to look any more. And thank you for listening to me and for your time, and very happy to take any questions that you might have.
Thank you, Patricia. Excellent talk. I'm going to get straight into the questions. One from the online audience, from David, is: does the type of cancer determine the depth of the CRF or brain fog?
Yes, I mean, it does, and especially, I suppose, whether it's a primary or a secondary cancer as well that somebody has. And I suppose, so especially in relation to cognitive impairment, if somebody's got a brain tumour, for example, they are going to have higher levels of cognitive impairment. And like I mentioned earlier as well, depending on the type of chemotherapy as well that they're having, will impact on both symptoms. So yeah, so whether it's a primary or a secondary diagnosis. And I suppose as well, if there's other things going on because of your actual cancer, do you know what I mean? We all know somebody might develop a lot of pain, or, somebody may have altered dietary functioning because maybe they have a gastric cancer as well. So that all is going to impact. And I mentioned earlier on, there's always one symptom has a knock-on effect on others as well.
Thank you. Any questions?
Firstly, thanks a million. That was an absolutely amazing talk. And I'm so delighted to hear about all the cognitive effects, et cetera, because I can identify with so many of them. Very informative. I'm just wondering, I have been on various treatments over, say, 10-year period, because I got cancer, say, for 5 different events. And I kind of feel that I'm still fatigued. Not all the time, but actually, as it happens today, I'm really fatigued. I'm only going to do half a day here. Does that... I don't know. I don't really know what my question is, but I suppose maybe it's just to get some acknowledgement from you to say, yeah, that's okay, because what I find now, I'm a very outgoing, bubbly person, and I'm just finding now, like, I'll meet one or two friends, and then the others, like, people are saying to me, oh, you haven't been in touch, etc. Because I don't kind of have an additional energy, shall we say. So I suppose I just want validation maybe as to where I am, and also my white blood cell count would be extremely low as well. I don't know if that affects the tiredness, but that's a very low reading on that.
Yeah, well, your bloods would certainly affect your fatigue levels. And I think what you're kind of saying is, to acknowledge, is that normal? And it is, and, some people will say that their energy levels never return fully to what they were before, even young people as well, what I've been reading anyway in the literature. But I suppose, like what you were saying as well, it's important maybe to actually, and one week you might have loads of energy and the other week it might be very different. But I suppose to actually, think of yourself as well and actually say, this is what I'm capable of today or this week. I have low energy. No, I'm not able to meet, a certain amount of people. And, generally fatigue does improve in time, all right? But, some of these strategies there that I mentioned, which is from the literature really, and I just realised as well, I didn't really go into complementary therapies. I was aware I had a lot of stuff on the slides, but some complementary therapies have been found to be very beneficial as well for fatigue. And I suppose over the last number of years, acupuncture has been found to be beneficial, all right? And I know some of the cancer centres are offering acupuncture as well. But, is there some strategies that might help you? But certainly going back to, and obviously I don't know your diagnosis or history, but you saying that you have low white cell levels, that is going to impact on your fatigue. Thank you.
And one last question from the audience.
Hi there, thank you so much. It was very interesting and informative, and everybody will relate a lot to what you spoke about there. I am also interested in what you said about the hormonal treatment. So I'm on hormonal treatment post my cancer,
Yeah.
and I also have fatigue, but my oncologist is suggesting that I make some changes to other types of treatment, which is less effective in preventing reoccurrence. So I'm trying to decide at the moment whether I have, just fatigue anyway, or whether, I maybe opt for this. I'm in that kind of phase now, trying to decide. So maybe could you elaborate on your point you made in relation
so sorry,
to...
are you saying the link between hormonal therapy and fatigue, is it?
Exactly.
Yeah, well, I suppose, you'll probably very much relate to this, and probably many more people here as well in the audience. Hormonal therapy has many side effects, most notably the hot flashes, insomnia, all right, would be very common, wouldn't they? And, sometimes mood, feeling tearful, etc. And that, but certainly hot flashes at night is going to interrupt your sleep, insomnia, that itself is going to really significantly impact on your fatigue levels. And I also mentioned as well about, reduced estrogen and progesterone levels as well. So certainly there is a link, and I suppose trying to cope with the symptoms as much as possible, in talking with your oncologist to try and help the side effects from the hormonal treatment. And, I suppose there are many different approaches, whether it's actually giving a drug for a side effect, okay, or actually looking at, in some cases, some oncologists will maybe stop the hormonal therapy for a short period of time and then start back in increasing doses. Do you know what I mean? And that has been found to be effective as well. But again, to talk to your oncologist about that. But certainly, yes, the link between fatigue and hormonal therapy is very much there.
Thank you very much, Patricia. That was excellent. Just give you a
Thank you.
round.
Thanks everyone for listening to me.